Thank you, Vasco Corda, and I welcome the opportunity to contribute to the statement today on universal health insurance. And it comes about, I suppose, from the publication of the white paper in the last week or so by the Department of Health and the discussion on the universal health insurance. I suppose the one thing about the white paper is that there's very little for ordinary people across the country to actually get to figure out what universal health insurance will mean for them. There's very little in terms of what it's actually going to cost the individual citizen to see how they can budget for it. There's very little in terms of the so-called baskets of care as to what actually will be in and what actually will be out, and I think that's one of the key points that's going to be very significant in relation to this universal health insurance at all coming into effect in the first place. Now, the Minister has made much about universal health insurance over the last number of years and about how it'll be the panacea to our health services. And I mean, the first worrying thing in the white paper is the fact that the government has stated that it's going to be achieved without increasing expenditure on health. Well, I mean, first of all, that's not possible. And there's no doubt that the health services are in crisis, and we do need to find a way to fund it, and we do need to find a way to fund the health services and provide equal and fair access for all our citizens. But we cannot do that, and it's not possible to do that without providing extra funding for the health services. Because even if the health services became more efficient and dealt with the waiting lists and dealt with the treatments that are required for patients who need it, it would cost more money. If we ended waiting lists and waiting times, that will cost. We'd get better outcomes, and in the long term, it might work out cheaper on the state 10, 15 years down the line when you have less serious illness has accumulated because of the lack of waiting time for people to get treatment that they require. But it will cost more money, and there's no doubt about that. And that, I think, is the biggest falsehood in relation to universal health insurance, that it can be done cheaper. It can't. And what will happen under universal health insurance is that the money will be directed away from the health services and into the profits of the private companies and into the profits of people who want to make money on the back of citizens who require health care. The Minister intends to establish hospital trusts across the country, and then the hospital trusts will be paid for services by the health insurers that will be operating in the market. So effectively what we're going to do is hand over control to the health insurers. So we'll have the VHI, and if we're lucky in this country we might have two other providers who will be dominating the market and controlling what they will pay for the services to the hospital trusts that will be established, and they will try to deal with the patients that they have on their books through the funding that they get from private health insurance companies. And in fact, the state will even take a back seat, and it'll be dictated to the state what the state has to contribute in relation to it. So we're handing over total control of our health services, and this is seen as being a progressive step, and this is seen as something that's going to be good for our citizens. I think it's an absolute disaster, and I think it's something that should be scrapped and should never even have got to the stage of being a white paper, because it's not something that's going to deal with any of the issues. And that is the fact of the matter. And I would like to think, Minister, that you believe in this, and you believe that it is going to resolve the issues and the difficulties within the health services, but there's absolutely no way. And unfortunately, I think in 5 or 10 years down the line, if you get back into government and if you get to be able to roll out this service, we will be sorry that we've ever done it, and we'll be trying to roll back from it again. If you talk about not costing the Exchequer any additional funding and providing universal health insurance, well, if we look just at the case of Letterkenny General Hospital, which is probably one of the most efficient hospitals in the country at the moment. I've heard, I think, something like 93% of this case patients dealt with in Letterkenny Hospital are non-elective patients. So it's run very efficiently, run very effectively, but yet Letterkenny General Hospital started this year with €6.5 million of a deficit. Now, if universal health insurance comes into being, as you say, and it comes into effect, and with no extra Exchequer funding and no extra cost to citizens of the state, how is Letterkenny General Hospital going to be able to survive with a deficit, providing the treatment that it is at the moment? And the only way that can be done is by restricting access and reducing access for people who require help and require treatment. So then we come on to the basket of services that are supposedly to be available under the standard insurance package. We simply don't know what's going to be in the basket and going to be in the basket. And one of the other worrying aspects of universal health insurance is that you've already provided for another basket of top-ups. So what we're going to very quickly see is movement from the standard basket into the basket of top-ups, because this has happened. It's happened in the Dutch model, where things like physiotherapy have been moved to a top-up payments under the Dutch model of health insurance. And is that what we're going to see here? And I would like to hear from the Minister, whether MRI scans or treatment like that will be in the standard basket, or will they be in the top-up basket? And those are the kind of things we're going to start moving very quickly once universal health insurance is implemented. And that's the real risks and the real problems that are with this system. In relation to the Dutch model, and much has been made of it, and the government says that universal health insurance will be gradually rolled out with full implementation by 2019 at the latest. That's 4.5 years from now, which sounds good. But in the Dutch model, which nobody has holding up except yourself as being a model to aim for, they took 20 years to implement it. They worked at it for decades to implement it. You're going to do it in 4.5. And in the Dutch model, when it was introduced first in 2006, I think there was 18 insurance companies providing insurance cover in the Dutch market, a market of 20 million people. Today, I think there's 5. There's 17 million people, okay, but there's still 18 insurance companies, and today there's 5. We have 4.6 million people. We have 3 or 4 insurance companies. How is there not going to be consolidation take place in there? So how is there going to be benefit for consumers in terms of this universal health insurance model, even if you accept it, or if I believe that it was the way to go? On purely market terms, you cannot provide for competition. You cannot provide for fairness for consumers in a market of our size with so few providers, when we see that a market 5 times the size, the number of providers has reduced by 80% since the implementation of this model. So this model can't work. I hope it never sees the light of day. I hope it stays as a white paper, and that's as far as it goes.